I remember when you walked in and one of our assistants was like, hey, Frank, I don't know, man. Like, this guy looks like a UFC fighter. And then I looked in the cameras and I said, he might be a UFC fighter, man, so you guys better make that smile right. And
if you're not going to see someone who is constantly looking to educate themselves, challenge their own knowledge, then, for me anyways, that would be scary.
ask questions.
Yeah.
And you decided to do your beautiful smile right now.
I did, yeah. I have 20 zirconia crowns.
20 zirconia crowns.
Maybe going across the border is a little bit intimidating to some people, whatever it is. All I can say is, me personally, I've had an incredible experience. I found the entire thing to be so easy, and I'm so pleased with the end result. So I think if you're hesitating, take the leap of faith. I mean, if you're going to trust somebody, you guys are the only people that I would recommend and trust.
Thank you.
It was all a dream. I used to read Word Up magazine. Salt and pepper and heavy D up in the limousine.
Welcome back to Supreme Dental Podcast Studio. You can be anywhere else in the world right now, but you're here with us. We appreciate that. Don't forget to like and subscribe. Remember, this podcast was meant for you, our patients. We're on Spotify and we're on Apple Podcasts. My wife and I are the owners of Supreme Dental Clinic. And remember, share with all your loved ones, with your friends, and let's keep this going. And today we have a very, very special person here with us, Supreme Dental royalty, I could even say, Mr. Doug Green. How you doing?
I'm doing great, man. Great to be here.
Thank you for visiting us all the way from Vegas.
Of course, man. Thanks for having me.
So, tell me, who is Doug Green?
Oh, that's a. How do you answer that short? At the end of the day, man, I'm a business owner, a father, a guy trying every day to be a little bit better than I was the day before. I think that's what our goal should be, right?
Yeah.
Do a little good, and have an impact, leave a legacy. That's who I want to be. That's who I'm trying to be every day.
Right. That's good. That's good. You were here how many years ago?
I came here May of 21. So almost 4 years ago.
Almost 4 years ago. Mm-hmm. And you found us online.
I did. I'm big on research, probably a little too much so.
That's good.
But research forever. And I knew what I wanted. I knew what I wanted to get done. And I reached out, had a great experience in the communication process, and finally decided this was where I wanted to go.
I remember you had told me that you were thinking about going to Colombia, if I'm not mistaken.
I was. Actually, I booked to go to Colombia, and it was because of some conflict that was going on there, that I was advised not to go. The clinic reached out to me and said it might not be safe for you to come, and I'm like,
that's a red flag.
Yeah, I don't think I want to come.
Yeah,
yeah. So then I was, they held my deposit. They didn't want to give it back. Whatever. I just didn't get a good feeling at that point, and so I looked more, and it was like some celebrity, dentist.
Yeah.
I'm glad I didn't.
Yeah.
Everything happens for a reason. So.
Yeah, I'm a fair believer in that too.
Yeah.
And you decided to do your beautiful smile right now.
I did. Yeah. I have 20 zirconia crowns.
20 zirconia crowns. Mm-hmm. So tell me how it was. What made you to that point say, I need to get teeth? Like, what didn't you like about your smile before?
Funny thing is, I really didn't have anything wrong with my teeth.
It was more of aesthetics.
I had a couple of my incisors were very pronounced, and I looked like a vampire. Like, honestly, they were very pointed and they were very pronounced, and I didn't like that. I'm not trying to look like a vampire. So, nobody ever said anything, but it was noticeable to me. And so I was like, I would like to do it for me. I mean, it's not for anyone else anyways at the end of the day.
That's exactly who it should be for.
Yeah, so I just decided that's what I wanted. And so it was my birthday gift to myself.
How did you feel after you had it done? Like, did it actually did we meet what you were thinking about? What change did it make? Or did it make a change in your life upcoming after that? What exactly?
Well, the funny thing is I was never someone who would smile, a big smile.
You'd be like this?
I was a smirk, kind of guy. And in most photos, I actually just looked mean, which unfortunately, the way that I look in general, if I don't smile, everybody's always like, why are you so pissed off?
Why are you mad?
It's just how I look. So afterwards, I started smiling, and it felt much more natural to have a big smile. And I think the best part was nobody thought that my teeth weren't real. So most people would just compliment, wow, you have really beautiful teeth. And I'm like, thanks. I don't say anything beyond that, right? But it felt good because no one, looking at some other examples, I think they're pretty obvious that they're not real. And if that's what you want, that's you. I didn't want that. So everybody would just be like, it's a beautiful smile. And I'm like, oh, thanks. So yeah, it felt good to that. And then that encourages you to smile more, right? Which I think softened my hardness to people,
Yeah.
And I think that does help in business because I just had a reputation. I'm quiet a lot of the times and just sort of have a solemn look. And I think a lot of people are like, what's up with that? So I'm trying to smile more.
A smile goes a long way.
It does.
It goes a long way. Like, I met, when I was young, I used to get sick all the time, and having a nurse or a doctor just come in and quiet, or someone actually smile, made a difference. Not even without them even speaking. Mm-hmm. It makes a huge difference.
It's welcoming.
It's welcoming. Exactly. It's welcoming. It just kind of makes you feel like you're more approachable.
Absolutely. Which I've been told I'm not historically. And that sucks, right? No one wants to be told that.
Right.
But you also need to hear constructive criticism.
Hey, but that could be good too, though.
Yeah.
So nobody's going to want to just mess with you.
Yeah, I know how to use that to my advantage as well.
Good.
Right? Like sometimes in the office, being the quiet guy who has that look, everybody's like,
don't ask a stupid question.
There are no stupid questions, right?
This is true.
Although, I'll say that on the podcast. Behind closed doors, there are some pretty stupid questions.
I remember when you walked in and one of our assistants was like, hey, Frank, I don't know, man. Like, this guy looks like a UFC fighter. And then I looked in the cameras and I said, he might be a UFC fighter, man, so you guys better make that smile right. And
I get told that a lot because I live in Vegas.
Yeah.
Right. So when I'm on a flight coming home, a lot of people just, I don't know, they just assume that's what I do. I let them.
Good.
It's probably better to assume that.
There you go. Has anybody asked you for a picture?
A couple of times at the airport.
Yeah?
Yeah. I mean, look, shaved head, tattoos, whatever. I just always kind of laugh and keep going. I'm not going to take a weird photo. They're going to be like, who the hell is this guy?
That's awesome. That's awesome. I remember there's been so many patients of ours that when you don't smile, and you don't do it on purpose, you're just used to not smiling. Mm-hmm. Or in pictures.
Yeah.
It's not that you're mad. It's just that that's what you're used to. Yeah. And people go back and say, oh, look, this guy looks like a jerk, or he's mad, or whatever. And I have so many patients that are business owners. And some guy from Ghost Pizza, he's the CEO of Ghost Pizza. Mm-hmm. And he said, I never smiled before, and everybody thought I was a jerk, right? And then I got my teeth done, and now first I need to learn how to smile. Yeah. Because then you kind of smile weird,
trying to balance it.
Yeah, you don't know how to do it because you're not used to it, right?
Right.
And then he goes, then when I smiled in a picture for the first time, it was at his buddy's wedding. He goes, everybody was like, wow, like he's super happy. He's like, I've been this guy all the time. He goes, it's just that, the smile brought this completely different energy, and I was a lot more approachable. That's what he told me. So you say you're a business owner. What do you do?
I do a few different things. I own a technology company, so we design, we do everything from design to installation and service after the fact, specifically related to video elements. So we custom design and fabricate, install large-scale video. So if you've been on the Strip, you've seen our work.
I seen at the Conrad, right? Is it the Conrad Marriott?
Resorts World.
Resorts World.
Yeah.
That's what I meant. Yeah,
Yeah.
Resorts World.
So we did all of Resorts World. We do a lot of work with MGM. So most of the properties on the Strip.
I remember Resort World. I'm driving up, and then I see on the full side of the hotel is all these screens, but they are actually like windows. Mm-hmm. And you guys did those, right?
Yeah, that's how I proposed to my wife, too.
I seen that video too.
Yeah. I was like trying to come up with something. I spent so many years on that property that I was like, it's only fitting that the property is how I propose.
We were just talking about that actually while before we entered the podcast with my wife and with the dentist there, because one of the assistants remembers you.
Oh, okay.
And I told her, oh yeah, you know how you proposed, because I seen it on social media. Mm-hmm. And then they told me, how did you propose, Frank? And I told them, well, it was something different, just a little bit less, a little bit more. I don't want to talk about it right now, but it was super cool, man. It was super awesome. And you also have done different things for concerts.
Yeah, so the company has two divisions. One is permanent installation, the stuff that we do for the casinos, and the other division we do live event production. So we have an entire inventory of lighting, audio, video, and so we do large scale shows, concerts, and anything entertainment based.
What's a concert that you've done that you're just like, wow, I did this?
So for me, my favorite from an entertainment perspective was the Outkast reunion.
Okay.
I grew up listening
Andre
to
3000.
Outkast. Yeah. So for me, that was the thing. It was in Atlanta. Everybody came together. There was an energy about it. I think they expected like 20,000 people, but like 100 plus showed up that weekend. But it was like this positive vibe. So for me, that was like the nostalgia of being able to do that Outkast reunion. And,
wow.
Andre and Big Boy don't get along anymore, so them to come together, it was cool. For me, that was my favorite. We've done a lot of cool shows over the years. Just that one stands out to me. I think it's also kind of cool to have done some artists early in their career and then see where they've gone.
Yeah.
So, like, we did Kendrick Lamar when he did the Kanye West Jesus tour.
Oh, wow.
That was
awesome.
like his first, introduction into a tour.
Yeah.
Obviously now he's
big,
quite a bit bigger.
Yeah, just a bit.
Did Bad Bunny, early days Bad Bunny, before anybody really knew him.
Yeah.
And he was like an early opener on J Balvin, So,
wow.
It's cool when you work with somebody and then you see them come up. Like, I think that's part of the fun of what we do.
Yeah.
You always want to see people win, or you should want to see people win. If you don't, if for some reason at home that's not you, check yourself.
Right.
Because people should want to see everybody else
succeed. Yeah. What has been one of the most your favorite concert that you've been to?
So because of what I do,
yeah,
I'm always going to focus not on the concert, but on the production value, right? So for me, my favorite show that I've seen has probably nothing to do with the act itself, but has everything to do with how the show was. Like, I think what Justin Timberlake did on his last tour with the large screen that folded down into the stage. I always appreciate automation, things that move, sets that rearrange themselves. Like, the more difficult it would be to execute, the more I appreciate it. So funny enough, I don't really pay attention to how the artist did. They could suck, and I would still appreciate
but the production was awesome.
The production, yeah. So for me, that's what I look at.
We're actually going to be in Vegas. We're going to go to the Sphere. We're going to go watch a Backstreet Boys at the Sphere, because we see my wife's a big Backstreet Boys fan.
Yeah.
And we're going to go to the Sphere, and we never been to the Sphere before.
Sphere is dope.
I heard. Some of our dentists have been there, but we never been there, so we're going to go see the Backstreet Boys.
It's cool. That's an experience. The UFC fight there was a whole...
Oh, though it was on the weekend of Mexican Independence Day, I think.
Yeah.
Yeah, I watched it on TV. I didn't get to go.
Very well done. I mean, the content, the storyline, the way that it was put together, that was really a unique experience. And I appreciated the way that they respected and appreciated the culture. You don't normally see that at a fight. So it was like a storyline that built as the night went, all around Mexican independence. And I thought that was really cool.
Well, I think Dana White's a genius, man, when it comes to things like that. Like It's all about when you're a business owner. It's all about you can have the same product, which he doesn't, but you could have the same product. It's attention to detail, the things that you do different, the things that you can tell when somebody really loves to do what they do compared to someone just doing what they do because they want to get money, you know?
They also could have just put the octagon in the sphere and called it a day. You could have just made it easy. And they didn't. They spent an exorbitant amount of money building an actual story that went in between each of the fights. And I thought that was really cool.
Yeah.
You know, if you're going to spend the money to put on a fight at the Sphere, then why wouldn't you want to really embrace all that it has to offer? And I thought they did an incredible job of that.
You were there, right?
Yeah.
That's awesome.
Yeah, it's beautiful. I mean, like, it really was. To experience it the way that they did it,
Yeah.
really beautiful.
Yeah, I see on TV. Obviously, I'm pretty sure it was a lot better in person, but
I think the way it actually presented on television was also well done.
yeah.
It's
But,
hard to bring the experience home.
yeah.
You know, that's a tough thing to do. And I thought they did a good job of that.
I've been to 2 Super Bowls, and the halftime shows are better on TV than what they are at the Super Bowl.
Yeah, I would agree.
You know?
I've been to the Super Bowl a few times.
And I'm just like, oh, that's cool. Like I went to the one where it was Snoop Dogg and Eminem and 50 Cent, Dr. Dre, and one with Rihanna.
Yeah.
And I didn't go to the one in Vegas. That's we were flying back from Dubai for a dental conference. I really wanted to go to that one too. But I'm like, okay, the halftime show was cool, but on TV it was, you know, they get all the angles and everything, and so
Yeah, depending on where you're sitting.
depending on what, and then some artists are looking at you and some people are behind and they never get to see them. You know, they're just seeing their backs. So.
Yeah.
What other businesses do you have?
So I'm also an area developer for a franchise. We have med spas. Our right now, so that Relive Health is the company that we're affiliated with. So we have 4 clinics that are currently open and more that are coming in the near future.
Nice.
Under our ownership, 24 total.
Wow.
So, yeah, it's similar business to one that you're in.
Yeah.
Right? We do a lot of the same things. Alternative medicine is really probably better said, because I think sometimes people only think about the aesthetic side of that business, which is absolutely a great side of the business. It's not all that we do. We are really big on blood work and getting to the bottom of what's going on with people, trying to help them not using traditional medicine if possible. And if we do see something that traditional medicine should get involved in, sometimes just making sure that people are aware of that. We've had some patients early, actually, in our very first clinic. We had a patient that had a close relationship with some of the staff and some of the people, and really difficult, but he wasn't feeling well and he wanted to get some blood work to see what was going on, and unfortunately uncovered that he had cancer.
Wow.
Young guy, 20s. Now, thankfully, he's in remission, but we were able to catch that early, and he's the kind of kid that probably would have never gone to the doctor. You know, so he just thought maybe he had some hormonal imbalances or, you know, something was going on. But that wasn't the case. So, you know, it doesn't always mean that we're going to be able to solve whatever's going on.
Yeah.
But it's great. I think young people, old people as well, but a lot of young people
Get checked. They need to get checked.
yeah, they just don't. And they think they're invincible like we all did, right? I definitely thought that. And so it's important to go in and you know, for females, a lot of times what their doctors are willing to check for, it sort of lives within the box, right? What they were taught in traditional medicine. And there are some tests out there that will get a lot deeper. And just most physicians don't know it, or they're not going to order it. And if they do, they're going to charge an obscene amount of money, and you know, it's going to be expensive through insurance and all this stuff. So we like to be an alternative to that. You know, so we look at everything holistically. Aesthetics are a side of the business. It's not the whole business. You know, a lot of times what you're seeing, for example, bad skin, you know, easy to just look at it as, okay, what can we do on the surface to treat that? But what if we find that the root of it actually has something to do with something inside, right? So it's more important to really get to the bottom of the root rather than just trying to treat something superficially.
You know, and we actually, believe it or not, we get to hear all the time. It's very important to go, for example, to a doctor that wants to take a look at everything. Dentist is the same way. For example, your situation was way different, but we get patients here that have been told, you can never get this, or this is not for you because of your bone structure or whatever. That patient a lot of the times says, hey, the way that we were brought up was whatever the teacher says is what it was. Whatever the doctor says is what it was.
Right.
During 2020, whatever Dr. Fauci said, well, he must know, he's the guy up there, right? And wrong, you know what I'm saying? So now it's there's dentists that go out there and tell you, hey, you know, you can't get this done. And a lot of people suffer for the rest of their life. You know, they're with dentures or whatever, and they have a gag reflex, or they can't taste their food because of their upper palate. And that's what we're doing. Because if someone tells you they can't get it done, they should say, we can't get it done, but you should keep on looking.
Sure.
You know, and they don't, they just end it there. And we've had so many people, from nurses to doctors to NFL players to different people that have been down here that have been told something, and we're able to still save their smile or give them a smile.
Yeah.
And on one of our videos that we have, it really hit me when it said that, you know, you changed my life, but you probably saved my life. Because a lot of people suffer depression, you know, not being able to smile.
Sure.
You know, and you have something that you don't like, and obviously if you have infection, there's probably some smell to it, and you don't want to laugh. Some people say that when they talk, they kind of use their lips to cover their teeth. Yeah, and that's not a way. That's not you. You know, that's not a way to live. So,
no. Who would want that?
Who would want that? But to some point, they believe that now it's normal because there's nothing else someone can do, and that's something that not just us. You know, there's great dentists all over the world, but it's just those dentists. Hey, you know what? At some point, we used to say we can't do it, but this is what you need done, but we can't do it yet.
Right.
And now we got to the point that we're doing things that, like zygomatic, like I was telling you yesterday, zygomatics and pterygoid implants that only less than 2% of dentists in the world can do. And we have 3 dentists that could do it. And it's for that reason, you know, to be able to offer you all your options. Now, it's up to you if you want to do it or not.
Sure.
But we showed you through all the technology that we have why it needs to be done. And if you get it done somewhere else and it doesn't work out, why it's not going to work out, you know?
Absolutely. I mean, that's a big difference, though. I think so many people, you can't put all doctors, you can't put all dentists, you can't put all professionals into one category.
You can't.
Right? Some are thirsty for knowledge, and they want to learn what's new, and they want to constantly evolve through their career. Others go to school, walk out of school, think, that's it, I know everything there is to know, and no one's ever going to tell me otherwise.
It's kind of scary.
It is, right? And unfortunately, I mean, if you look at medicine as a whole, and dentistry is no different, 20 years ago to today, right? The technology has changed incredibly. You know,
completely.
Look at a knee replacement. It used to be a super invasive surgery, and now it isn't, right? So if you're not going to see someone who is constantly looking to educate themselves, challenge their own knowledge, then, you know, for me anyways, that would be scary.
Ask questions.
Yeah.
You know, and they answer their question, your question, because if they don't answer your question, you know, what are you doing?
Yeah, and don't dismiss. That's the other thing is, I've seen a lot of medical professionals that are very quick to dismiss what's brought up by a patient. I'm not saying that there aren't patients that are going to ask things that are, you know, they probably spent a little too long on Google or something, and they've self-diagnosed or whatever. But it doesn't mean that people aren't educating themselves. I think information is more accessible now than it used to be.
Right.
And so I think sometimes it's important to listen, you know, and people know when they don't feel right. People know when something is wrong. You know, I understand there are outliers to that, hypochondriacs or whatever, but overall, like, I can recognize when I don't feel the way that I should feel.
Yeah.
So don't dismiss that. And I think in what you guys do as well, right? Like, as people, we're insecure. Admitting that is the first step. I don't care who you are. Arrogance is just a way of hiding insecurity.
Right.
right? We're all insecure as people. Whether or not you're willing to admit that out loud is a very different story. But if you are willing to, then like the only way you're going to change or fix or get to the bottom of whatever is causing that insecurity is to own it, to say it out loud, to be willing to speak about it with whoever it is that can help you, right? And I think you guys do a good job of making people feel comfortable to say it. You know, that's the only way you're going to be able to help them.
Right.
You know, what is it that you really want?
Right. You're 100% right. And we get a lot of patients that don't really know what they want. Sometimes we get patients here. I don't know if it happens the same thing with you guys, but we get patients that come in and they're really choppy. You know, they're really choppy. Like you ask them a question and just close it, just something close, quick.
Yeah.
And they're not mad at me. They're not mad at us. You know, they're mad at themselves because they're in this situation.
Right.
You know, and that's what I had to teach my team about. Like, hey, it's not that this person wants to be mean to you. It's that this person is mad at themselves.
Sure.
So once, you know, let's open everything up and let's make them feel like they're in a safe place and that they're not going to show us something that we haven't seen. Because we've been here for 17 years. My wife and I opened this place when I was 21.
Wow.
I'm 38 years old. Look at these. Oh, man.
Don't get me started, man.
and
but your
crazy.
face looks pretty on the interstate.
I appreciate that. Photoshop. It was his picture. Yeah. A quick question before we leave, because I know you're on a time crunch before you go back.
Yeah.
Is there anything that you want to tell our patients out there that are waiting to get it done? They don't know if they should do it or not. Is it worth it or not?
Absolutely. I mean, I know it's a little bit scary to travel to get work done. I mean, I think for some people, you know, if you travel all the time, it's no big deal. It can be scary to go somewhere that you don't know and that you're unfamiliar with. I mean, I was a little bit, right? I mean, I had a good experience leading up to, so I felt good. But you're going somewhere that you've never been before. Maybe going across the border is a little bit intimidating to some people, you know, whatever it is. All I can say is, me personally, I've had an incredible experience. I found the entire thing to be so easy, and I'm so pleased with the end result. So I think if you're hesitating, you know, take the leap of faith. I mean, if you're going to trust somebody, you guys are the only people that I would recommend and trust.
Thank you. Well, and one last question.
Yeah.
Was it worth it?
Absolutely. I would do it all over again.
That's exactly what we wanted to hear.
Yeah. I would tell anybody. I mean, my wife has asked me, you know, are you happy? Now, you know, now that I've done it, I'm extremely anal about my teeth. Right? I floss 3 times a day.
Good.
I'm like, you know, the things you might not have done originally. Correct. Now I'm like, no, I want to take care of this. But she asks me all the time, you know, are you happy you did it? I'm like, absolutely. Without a doubt. And so now she's, of course, like, she has perfect teeth, but she's like, maybe I'll do it. I'm like, there's nothing wrong with your teeth.
Right.
But, you know, I think she's seen me be happy and how much confidence it really does. It gives you confidence. So I think if you are hesitating, don't.
Well, your smile looks great, man. It's been 4 years already. So
thank you. I appreciate it.
It looks good. I could see how it could be intimidating, and then you're just like, and now they're like, I don't know, is he smiling because he's gonna do something to me, or is he just happy?
Yeah, I might get that sometimes, you know.
And that's good.
That's fine too.
Yeah, I'll take that any day.
My staff need that intimidation.
There you go. Well, there you go. Well, thank you so much for being here today.
Thanks for having me, man.
And this has been Supreme Dental Podcast Studio, powered by Supreme Dental. And just like Mr. Green, keep on smiling.
And if you don't know, now you know, you know, you know.
That's right.
And if you don't know, now you know, you know.